Denise Gooch, radiation oncology, and I'm actually a native Washingtonian, born and raised in Washington, D.C. I did my schooling, my undergraduate as well as graduate degree in Washington, D.C., and I did my radiation oncology training at Ohio State, Columbus, Ohio. And go Buckeyes, yes. I've always been the one that wants to take care of people. As a child, I wanted to take care of people. People would call me up and tell me they don't feel well, because I wanted to know. I've always wanted to take care of people. I'm actually internal medicine trained. And as part of our residency, we were required to do a rotation on the oncology floor. And all of the residents all basically tried to avoid doing this rotation. And so after I was on the rotation for about a week or so, I actually said, I kind of like this. So I went to my program director and said, I know I did my 1 month in oncology. Can I do another month in oncology? He looked at me. He said, I've been here 16 years. You are the first resident who's ever asked to do a second one. So you must really like oncology. I said, I really do. There was a patient, even though I was already in the residency, that was one of the most amazing patients to this day I've ever met. Basically what she said was, I know I have this cancer and I know that what they're telling me, she said, but I'm going to be fine, I'm going to be healed, I'm going to have a baby after all this, and all of this will have gone away. A year later, I was walking by the elevator and suddenly the elevator opened. She steps off the elevator with her husband carrying a baby. And I was, oh my goodness. I literally ran to my office, pulled up her case on the computer. Everything was clear, everything, and for all intents and purposes, that should not have happened. And I was just so, I came in the room, we were just talking, and she said, I told you. She actually posted it online. She said, I mentioned you. She said, I mentioned the story and I mentioned you, how no one believed me, but I could tell you believed me. And I actually documented this and posted this online. She said, so I want to thank you for that. My feeling is to do oncology, you have to feel a little bit deeper. You have to care just a little bit more. One thing I always want every patient to feel is that I'm here to take care of you, that I care about you, I care about the whole process you're going through, and I want to hear your story. Because one thing I used to tell everyone, maybe I can't always make it go away, but I can always make it better. And that's my goal, to always make it better.